Hey everyone, John Castor here. Today I wanted to introduce my special guest who's going to talk about how you can improve your health and wellness with less medication. Her name is Luisa Carreiro Powe, and she is a physician assistant and owner of PA-Powe Wellness. Luisa?
Thank you. It's a pleasure to be here. I am a physician assistant. I've been practicing for 22 years. Love, love, love my profession. As you may know, PAs are trained to diagnose and treat and write prescriptions. And at times you may have to do that, but my true passion lies in changing people's lifestyle and really advocating self-care. I think it's really important that patients start truly understanding what they can do for themselves. And, we know people need to lose weight, eat healthy, exercise. And we all know that. I think it's important to facilitate that and really show people how to make it easier. My mission truly with PA-Powe Wellness is that we need to make healthy choices easily accessible. I'm a wife, I'm a mother, and I'm a working mom, and to actually be home, and we all know that cooking healthy is the key, and eating out less is better. Although we do eat out a lot and we make great choices, and you can do that too. But how do you prepare a meal that tastes delicious and is not going to take 3 hours? Because we know it only takes 20 minutes. It should be taking us longer to eat, but it only takes 20 minutes
Right.
with our kids running from school to homework and then to activities. So as a mom, I know how difficult that can be. So my goal is to really help others facilitate their lives to do it as well. And it can be done.
I'm sure our listeners have a few questions,
Sure.
but I have a few questions for you that I'd like for you to answer for them. The
Okay.
first one is, what is truly your philosophy on self-care?
Right. I think, we really need to step up and take care of our health and not leave it to somebody else. So I always tell folks, educate yourself. Feel free to ask questions. In the medical field, we tend to go off on tangents and talk in medical terms. So it's okay to stop and say, can you explain that to me? And I always love it when people bring a list of questions to their appointment, because I know exactly that we've covered everything. And now things are getting a little more intense now that everything is, on not on file, but medical electronic
Right.
records. So and this even happens to me when I go for an appointment. I'm noticing a lot now that people are looking at the computer and not so much engaging with me. And hopefully that'll change, because I think we as practitioners are getting accustomed to this whole new technology. And but it's really important. And a lot of times I find that a lot of medications we are basically forced to prescribe because we don't want someone who has a sugar in the 300s not to take medication to bring that down as quickly as we can. But my thing is prevention. If people are eating healthy and exercising, then we hope that your sugar will never get to 300. And I think what we really need to concentrate on is that we are eating is essentially, it's not much more than nutrition, but it's medicine. And we have to pay attention to that and know what you're eating. Just don't eat on the run. I often think, if I'm not going to give it to my child, then I'm not going to eat it either. So, I don't even give it to my dog. So it's,
So it sounds like the biggest issue in your philosophy is that the first solution shouldn't always be to hand over approach. It should be prevention and also some alternative or supplemental
right.
options.
And the thing is, I'm not, by no means, please understand, I am not telling anyone to come off any medication.
Absolutely.
Because if you do that, then, you're risking your health and asking for, it's very dangerous to do. But we as healthcare providers are not trained to really teach folks nutrition. And that is why I went from being a PA, and once a PA, always a PA, but I am also a health coach. because I felt that we really need to instruct people on how to eat, what to do, and not just say, take this pill and come see me in 3 weeks.
Right.
And it's a whole lifestyle change, and we're busy people, and it's attitude. You know, I'm part of the Dr. Lean Coach as a health coach, and we stress lifestyle, exercise, attitude, and nutrition, and they all go hand in hand. Once you start eating healthy, you align yourself with people who are eating healthy, you become an example for others. By no means, that doesn't mean that you can't have, you know, something every once in a while, but it should not be our everyday thing. I remember growing up, you know, dessert was maybe on the weekend, and now it's so easily accessible that kids expect dessert after every meal. You know, in our house, it's fruit, and sometimes I get the look like, really, I can't have anything else, and all the other kids are eating this, and it's part of safety, and we need to show this to our kids. You know, I always follow it with, I'm doing this only because I love you. But yeah, when we have kids over, sometimes we'll have pizza. You can't deprive them, but you need to educate your child on what is healthy for them. And that's how it becomes a lifestyle. They see you doing it, and they in turn want to do it. My son loves basketball, so, you know, and he's 12, so he's at that age where it's difficult to convince a 12-year-old that mom knows best. So I always use, hey, if you want to be, you know, good on the court and you want to be tall for basketball, these are great foods. These are the foods that are going to help you. Now, you know, every once in a while we'll have a little something, okay, and you'll see that once your body is accustomed to eating healthy, when you have something that's not so healthy, your body kind of rejects it, and it's like, ooh, you know, it's not what you want to do.
So I have another question.
Sure.
But it sounds like today it's even more challenging, just convincing and sharing healthy ideas and options, because as you said, you know, he's at a young age to begin with, so he's under a lot of social pressure. But more importantly, the outreach and the opportunity to eat unhealthy is so common that all of his friends are making those poor choices just out of default.
Well, I wouldn't say all of his friends, because, you know,
a lot of his friends.
But when you're in the school atmosphere, you know, even when it's like this bake fair, or if we're having parties, people will automatically bring high caloric cakes and chips,
right,
and we don't gravitate to, you know, fruit and vegetables. It's just not our society. And I think we need to start seeing that more and more. You know, there's smoothies, there's so many great desserts that you can make that can be really healthy for you. But again, it's got to be something that's easy and tastes good. And we have to get over that philosophy that people used to think, oh, if it's healthy, it tastes terrible. I mean, that's just not true. Now, we are challenged that a lot of these processed foods are high in sugar, salt, and fat, and that stimulates your taste buds. But we also, and that's a whole different conversation, have to realize that these, you know, the food industry is doing that, and they actually have chemists who are out there sampling what's the best combination of tastes here to get folks to buy and buy more.
Right.
So
it's all marketing.
It's all marketing. And I have nothing against, you know, promoting and marketing, but promote something that's for the benefit of health and the good of mankind.
So much easier for these companies to, and so much more inexpensive for them to create high calorie, low quality foods that taste good.
And you often wonder if they're feeding that to their kids. Right?
I would like to know that.
Yeah.
So going back to what we were saying more about the medication and what you can do for yourself, what would you see as the most common issue today on that in that respect?
Sure. I mean, diabetes, and this being November and Diabetic Month, is huge. I was just at a conference this past weekend on diabetes, and it's just astonishing. We used to think of diabetes type 2 as something that we would get, when older, but now we're seeing it in children. And what's happening is it's very commonly related to obesity. And, when you're eating all this sugar, then it's not that diabetes is caused by eating sugar, but it's a wear and tear of your beta cells of the pancreas. And so we lose beta cells regardless, as part of aging. So as we're eating all this food, it's just more wear and tear in your body. And we're seeing diabetes, outrageously high now. And if you think back, with the high fructose corn syrup, I think it came out like in the 70s.
Mm-hmm.
And if you look at the increase in diabetes, it almost correlates exactly hand in hand. And if you notice, when people are getting obese now, their whole body habitus, the way it's changing, it's the kind of foods that we're ingesting.
Mm-hmm.
Dr. Sears from the Lean program talks about, the taboo foods or high fructose corn syrup, additives, these, food colorings, and anything, the hydrogenated oils and partially hydrogenated oils. And the reason those certain things were used, you may say, well, why are we using it in our food? Is because by doing so, it could preserve the longevity of the food and it could stay on, the shelf longer and longer. So they could sell more and more of it, right? Marketing. So it's something that we have to realize that we have to take the responsibility. Try this. I did this the other day. I took, with my son, I took a loaf of white bread, and I didn't put it in the fridge. I just left it out in the pantry. And 2 weeks out, and there was still no mold on it.
I can't do that.
Try it. And I want you to be skeptical and say, oh, what is she talking about? Try it for yourself. And it was a great lesson because I said, look at this. It's been out here and there's no mold. So what do you think you're going to be eating if you have that? So kids are so intelligent and they like to see this. So we need to share that with them.
I find it very interesting that you mentioned the high fructose corn syrup and hydrogen oil, because lately, you had the low-fat craze and the sugar-free craze, and that kind of spun around in the marketing. So people would say, coming from 90s and into 2000, they would say fat-free, right? But they had all this additives. And then, 2000 into now, it's been sugar-free, right? Which is terrible in itself as well. And now the trend is the no high fructose corn syrup or hydrogen oils. Where do you see this trend going? What's next?
I think what it comes down to, if you recall, when we said fat-free, right? What did they do? They increased the sugar.
Right.
Okay. And you would literally have to be a marathon runner, to burn all those extra calories.
Mm-hmm.
So that didn't work for us. What works for us is eating real food. And, Dr. Sears often says it's not about no fat, it's the right fat. 60% of our brain is fat. So we need good fat. That's why breastfeeding is so good for babies, because, the mother's breast milk is high in fat. We want children to be eating and drinking, having good quality fat when they're little, because it's promoting good development of their brain. So it's not, people shouldn't be afraid of fat, but it's the right kind of fat.
So embracing the healthy monounsaturated.
Yeah, exactly.
Fats.
Exactly. Omega-3s are huge. And I know a lot of kids aren't into eating sardines or salmon. My son actually likes salmon, but there's other ways of getting around that.
What are some options?
Well, there's flaxseed. You can throw that in the smoothies.
Mm-hmm.
And smoothies are great because you can throw in fruits and vegetables, and it tastes delicious, and kids are getting a lot of their nutrients.
Sneaky.
Yeah, but you don't want to sneak too much, because you also want them to know that broccoli tastes like broccoli and it's good for you. Mm-hmm. Because then if you're just associating that with a sweetness, they're going to expect vegetables to be sweet. So you want them to know, what they're eating, and vegetables is good for them. But sometimes on the run in the morning, breakfast is being the most important meal of the day, we have smoothies sometimes, which is great and easy to do. And I really love making a really great, decent breakfast. You know, oatmeal with fresh berries and nuts is great.
Last thing I want to ask you today, what can people do to help themselves stay off medications? I know we don't want to tell people, our listeners to not take the medications, but what can they do to either avoid and prevent or transition off with medical supervision?
Right. Well, the thing is, losing weight will, help so many conditions. For instance, high cholesterol, hypertension, diabetes. Those are all conditions that if we try to prevent before we get there, then you won't even have to be on those medications. Now, I've had a lot of clients who've lost weight and will come off those medications, but trust me, it's a lot easier not to get to that point. So that's why I'm so big on prevention. Now, I've heard it said that prevention is not a sexy word, so people aren't doing it. So I don't know what the sexy word is going to be. I think healthy is pretty sexy, but we really need to change our mindset about eating real food and getting real results.
So it goes back to habits.
Goes back to habits, and habits are hard to break, but if you concentrate on, what's positive and it's helping you, trust me, I'm the type where I will taste and eat something. If I know it's good for me, then I will do it. Not everyone thinks that way. And it's all your priorities. For me, health has always been a priority of mine because I knew that, my dad often said, if you're not healthy, you're not going to be able to do a lot of this stuff as you get older. And, that's always something that stuck with me. And that's why I went into the healthcare field, because I wanted to help others who didn't get it. And it's not that, they didn't get it for whatever reason. It's just people have different priorities. And so I think once you realize that once you're healthy, you're unstoppable, then people will invest the time to make those changes in their lives.
Great. Well, do you have any last words of advice for our listeners?
Just, really concentrate on eating the right foods. I always think about, when I'm eating, is this going to hurt me or is it going to help me? And, food is a wonderful thing. It's social, it's cultural, but realize that food can heal or it can hurt. And right now it's hurting a lot of people.
Completely understand that. Where I'm coming from with my
Right, with exercise.
So thank you for joining me today, Luisa. I appreciate it.
Great
Look
to be
forward
here.
to having you again.